Hey everyone, this is Jenna, and today we are discussing the global impact of health information systems. Health information systems play an important role in supporting global nursing practices, administration, research, and education. These systems connect the healthcare profession, streamline processes, and enhance our ability to deliver care. First, we'll focus on the transformative impact of health information systems in the nursing practice. While we talk about the benefits of HIS, we must also acknowledge the challenges. Rural and underserved areas often lack the necessary funding for adequate HIS infrastructure, which limits access and care coordination. For systems with HIS in place, the technology has increased connectivity between providers, allowing for easy sharing and accessibility of patient information. Providers can also recognize adverse events more quickly, significantly enhancing patient safety and care quality. HIS helps streamline workflows and reduces the workload for providers, allowing for faster documentation and more time to dedicate to patient care. This, in turn, increases treatment quality and reduces stress for staff. Since its inception in 2004, the Technology Informatics Guiding Education Reform, or TIGER, has driven the rapid integration of technology in healthcare worldwide. Advancements in automated drug dispensing systems, electronic health records, telehealth, and clinical decision support systems have fundamentally transformed healthcare delivery. Key benefits of these systems include minimizing adverse events, enhancing clinical decision making, and most importantly, promoting patient safety. These technologies have not just changed processes, they've improved the quality of care that we provide to patients. Incorporating technology into a person centered profession presents its own set of challenges for healthcare leadership. Artificial intelligence has undoubtedly become a powerful ally for healthcare leaders. AI helps in managing resources and automating tasks, but an over reliance on AI can actually hinder leadership's growth and erode communication skills. Another hurdle leaders face is the technical knowledge gap. Without proper training, leaders might find themselves unable to translate AI outputs into actionable data. It's important that we equip our leaders and nurses with the skills they need to use technology effectively while still maintaining the human connection in patient care. Health leaders need to manage the relationship between nurses, patients, and technology. Technology can lead to innovation. However, patients still need personalized care with meaningful interactions and an open dialogue with their healthcare providers. Research plays a vital role in the worldwide advantages of healthcare information systems. The COVID 19 pandemic showcased the rapid evolution of healthcare technology usage. The growing dependence on patient data facilitated the sharing of global insights, which has been instrumental in the development of precision medicine and predictive analytics. These advancements have proven essential in addressing various diseases across the globe. Research can help drive medical programs, assist in epidemic management, and promote best practices that address the diverse needs of populations. Global connectivity enables researchers to study various populations and specific diseases with greater efficiency. However, a significant challenge has been identified through usability constraints. Data standardization is important for conducting accurate, large scale research. When data is missing, incomplete, or poorly organized, it undermines researchers' efforts. This issue is often attributed to inadequate training or inconsistent protocols among institutions. The shift toward tech literacy is not just a trend, but a necessary adaptation to ensure nurses are prepared for the future of healthcare. It empowers them to provide better care and improves healthcare outcomes across the globe. There is a growing global expectation for nurses to be tech literate. This stems from the increasing integration of technology into healthcare, making tech savviness essential. Countries like the United States, United Kingdom, Canada, and Singapore are leading the charge of incorporating technology deeply into nursing curricula. Nursing education has embraced simulation, gamification, and electronic health records. These tools prepare students to navigate real world healthcare settings effectively. By engaging in scenario based training, students can hone their clinical reasoning skills. So, now we'll look at the benefits of health information systems through the lens of income. In high income countries like the United States, advanced infrastructure and clear policies significantly enhance patient outcomes. However, in Sudan, which is a lower income country, the challenges in infrastructure and limited access to technology have a dramatic impact on healthcare delivery. In the United States, the robust system support extensive data and data driven decision making, which improve patient care. In contrast, Sudan's constraints can hinder health services and overall outcomes. The United States has advanced interoperable electronic health records and reliable internet connectivity, both of which are instrumental in providing quality care. In contrast, Sudan faced significant challenges with a fragmented digital presence and limited health information systems. The US benefits from clear legislation and FDA oversight, ensuring the safe application of technology in healthcare. Sudan, however, has minimal health regulation and oversight, which restricts the effective implementation of technology. This difference impacts equity and access, with the US having fairer systems and less bias, whereas Sudan lacks the necessary localization and ethical safeguards. Lastly, the application of AI in healthcare is widespread in the US, enhancing system performance and patient outcomes. Meanwhile, in Sudan, AI is mostly restricted to pilot programs and in the early stages of tech integration. While the US leverages technology to improve healthcare delivery and access, Sudan is still at the beginning of this journey. These differences reflect broader global inadequacies between rich and poor nations. In the United States, life expectancy is around 78 years, whereas in Sudan it's about 65 years. This difference highlights the disparity in healthcare resources and access. Now, moving on to infant mortality rates. The US sees about 5.3 deaths per 1,000 live births, while Sudan experiences a much higher rate at 37 deaths per 1,000 births. These figures can be quite telling about the quality and accessibility of maternal and infant health care. The US has highly digitized systems contributing to efficient healthcare delivery. In contrast, Sudan's health information systems are underdeveloped, impacting the ability to effectively manage and utilize health data. The leading cause of death differs significantly in each country. In the US, chronic diseases are the major concern, whereas in Sudan, infectious diseases and trauma are more prevalent. This difference is a direct reflection of the healthcare challenges faced by each country. Overall, the US benefits from better outcomes due to substantial healthcare spending, robust infrastructure, advanced health information systems, and greater overall access to trained healthcare professionals. These factors collectively contribute to a more effective healthcare system compared to the one present in Sudan. OpenMRS is a tool that emerged in 2004, aiming to bridge the healthcare technology gap in low and middle income countries. Its primary functions include recording patient data, providing clinical support, generating data analytics, and supporting a multi site integration. These capabilities are especially important for regions where healthcare resources are limited, and we will explore the implementation and adoption of OpenMRS and some of the challenges that were faced. OpenMRS, again, is an open source medical resource system widely used in low and middle income countries, especially in Africa. Key applications include managing HIV treatment, tracking tuberculosis, and maintaining primary care records. While OpenMRS offers remarkable flexibility, users often face a steep learning curve due to limited training and support. This can be a significant barrier to effective utilization of OpenMRS. Interoperability is one of OpenMRS's strengths, allowing data sharing between healthcare systems. However, lower income countries encounter obstacles such as a lack of computers, unstable internet, and an insufficient resource for training and long term use. These barriers highlight the need for more sustainable solutions. Health information systems have the potential to revolutionize healthcare delivery, enhance data sharing, and support better decision making. However, a significant issue arises when we consider how disparities in access affect rural and low resource regions. These disparities mean that marginalized populations are often left without the benefits of modern technology, which can widen existing gaps in healthcare quality. AI proposed a solution to meet this gap. In low resource areas, there's a need for diagnostic tools that work offline with language models that can adapt to multiple languages. This would support better health communication, and offline capable technologies would ensure that even underserved communities could benefit from health information systems without depending on stable internet connections. The goal is to create an inclusive future where everyone, regardless of their location or resources, can access quality healthcare technology. I want to thank you for listening. And in addition to the reference slide, which is next, I would also like to acknowledge that ChatGPT was used to generate several of the images and graphs and data sets used in portions of this presentation. And here are the rest of the references, including OpenAI, that were used for the information covered in this presentation. Again, I appreciate your time and thank you for listening.